Hi, my name is Vickye Hayter. I am a licensed clinical marriage and family therapy and a fellow in the Minority Fellowship Program, completing a PhD in nursing at George Mason University.
And tell me, what were you doing this morning?
This morning has been amazing to walk with other nurses, to visit the Capitol, and to talk to our legislative representatives about the Minority Fellowship Program, celebrating our success and how important this program is to minority mental health providers. We had a chance to meet with the staff of Jamie Raskin in District 8 and to talk wonderfully with her about our experiences and how important this program has been for us to continue to further the work as minority mental health providers and garner the support that is necessary to continue the work that is being done. We would like them to understand the importance of trauma-informed care. As nurses, we want to make sure that all nurses are trained in trauma-informed care, and it's really, and I'm sure our Representative Raskin is very much interested. This is a personal experience of his around health and cancer and son committing suicide. So it is essential that everybody, nurses are trained in trauma-informed care, that we have programs that allow not just minority nurses, but all nurses be informed in this area. There's too much unaddressed trauma in our society, and that causes ripple effect.
It's kind of melancholy, but it is a happy moment. You're going to have Jamie Raskin unplugged from now on.
So I've been a nurse since '96. So how many years is that? I don't know. So 2 decades, let's just put it like that. And I see, as far as mental health, behavioral health, we've missed it for a while now. There are certain programs that have been out there and aware of this work, but as a whole, we've separated physical health and mental health. And as nurses, I certainly believe we need to bridge the gap. And so the way we provide care can't just be focused on, say, physical injury trauma. It also has to be focused on psychological trauma. Those two go hand in hand. You can't do one without the other. The cost of not providing more of a holistic perspective of care there's a cost not just to the patient, but the provider as well. You will find that the healthcare system is crumbling as a result of not having this integrated way of doing care. So we want to separate out the issue of one person versus the other, but if we could get so much more accomplished if we recognize it from a holistic perspective and we treat patients from this more personalized and holistic perspective. And nurses as providers have their own level of trauma they experience, whether it's from secondary trauma from the patient, or it's from the workplace trauma, from something such as insufficient resource trauma. And so that also has to be addressed because we're losing nurses as a result of the workforce trauma and lack of organizational support. And so COVID showed us that nurses fled the field because they were so overwhelmed. There wasn't enough support. And I know we weren't prepared and we didn't know COVID was coming, but it spoke volumes to the impact of trauma to patients and providers.